Hello everyone. Today I'm here with another topic, and this topic is related to people who are applying for green cards, or rather what we call immigrant visas, who plan to come to America for no matter whatever reason you have, but as long as you are applying for green card, whether it will be green card by marriage, green card by family, green card by lottery, as long as it is green card, which we call immigrant visas. So if you are applying for that one, there is a new proclamation, presidential proclamation on that regulation, and this is to suspend people who will be financial burden to the healthcare system in the United States of America. So this video is going to talk about a presidential proclamation number 9945, which is a proclamation on the suspension of immigrants who will financially become the burden to the United States healthcare system. I talked already in another video about just overall the public charge rule which has been in place, but this one is specifically on healthcare. And again, so on October last year, 2019, the two announcements came out. One was overall the public charge rule, and another one was on healthcare. So this one is on healthcare, which is presidential proclamation number 9945, which is this way. The president issued the presidential proclamation number 9945 on the suspension of entry of immigrants who will financially burden the United States healthcare system. So what does that mean? And how will that affect you if you are applying for green card? So when we are assessing this one, there are a couple of things you have to know. The new proclamation is going to provide new change or new requirements for the entry of people in the United States on the immigrant visas. Again, on the immigrant visas, I've been talking the difference or distinction between immigrant visas and non-immigrant visas. Immigrant visas are visas someone is applying to become a permanent resident on coming here to stay permanently. And non-immigrant visas are temporary visas. So this policy, this presidential proclamation is not affecting people who are applying for non-immigrant visas. The policy does not cover those applying for temporary non-immigrant visas like students, temporary workers, tourists, visitors, whatever all those kind of visas are not covered. So it doesn't matter. You are not going to be asked on this one. This one is going to cover or is concerned about the people who are coming on the immigrant visas to enter and stay in the United States on the permanent basis. So under this proclamation, applicants for the immigrant visas, applicants for the green card are required by law to show that they would have approved health insurance within 30 days of entry in the United States, or they have financial resources to pay for reasonable, foreseeable medical costs. This is very critical. You have to show you have approved health insurance within 30 days of arriving into United States, or you have financial resources to pay for reasonable, foreseeable medical costs. And those medical costs are not subsidized costs. It's just a plain, the one without hoping to wait, like we are talking about the public charge. These are not, you are not waiting, oh, I have this $10, I'll wait for the other money from the government. No, on your own, you can be able to do on your own. Having Medicaid or tax subsidized health insurance on the marketable plans will not be accounted towards to this one. So you don't need to have subsidized one. You need to have the actual market health insurance. So this proclamation has a lot of similarities with the public charge regulations. But this one is only on the medical. And again, you have to prove either you don't have the health insurance at hand, or you have to show the financial resources you have, which means you have to prove how much you have, the person who is sponsoring you, for instance, or yourself, how much you'll be having to be able to be above the poverty line. By poverty line, we have a guidelines each year. Beginning of the year, the US government provides what we call the poverty baseline. This poverty baseline is very clear. So for instance, on January 15, 2020, the new guideline came out. So which means it shows like if you are one person, you need to have how much annual income, if you have a family of 2, 3, 4, 5, whatever. So average, the family of one is 12,760 per year. So you keep adding 4,480 each person you are going to add. But overall, so you need to show you have that one, or the person is going to sponsor you. If I'm sponsoring for my relative, I have to show that I will be able to cover, I have the financial resources to pay for any foreseeable reasonable foreseeable medical cost, or I have to purchase the health insurance in advance. So why this one is very critical, or why is it a must? So the reason of this one, according to the proclamation itself, it says they projected that if you look someone who is immigrant, you are coming from another country, you're coming from Nigeria, you're coming from Tanzania, coming from Kenya, coming from Somalia, coming from Sri Lanka, Nepal, whatever country you are coming from, you are likely to become a burden compared to a person who is born here. Remember, there is Obamacare. And even currently now, being here without health insurance is kind of like a crime. So on the tax filing, during the tax return filing, which is January to April, you have to indicate, you have to prove to the government that you have health insurance, whether it's affordable health care insurance, which is famously known as Obamacare, or your private insurance. You must prove you have insurance. Failure to have insurance, health insurance, you might be going to jail, or penalties, or other crazy stuff might go into you. So, because now it is a mandatory, so, and the government is not trying to give more people health insurance, affordable, and whatever cover, certain subsidize, all those kind of things. So they are trying to reduce the number of people who will be there. So if you are immigrant, you are coming here, you need to prove that you have, don't become a permanent resident, and according to the US government, and waiting for us to take care of you. So if you are coming here, you must be capable of handling your own business. So that is what they are talking about, because they say so immigrant is likely to become a burden compared, like the percentage wise of person born here will be a burden, but it's not like someone coming here, because someone already here already have work experience, doesn't have whatever, have a problem of accent, doesn't have the problem of finding the work experience here, or knows already how to look for a job. So the likeliness of this person to be publicly charged, if you compare with immigrant will be higher. That's why they put it specifically for immigrants for that particular purpose. Okay, so. And that is already on effect, already on people to have to use that. So you must have the approved health insurance, and that health insurance is not supposed to be, is supposed to be unsubsidized. The pure plan without that one. Alternative of that is to show a financial resources. So in lieu of showing approved health insurance coverage under that proclamation, an applicant for an immigrant visa can establish that they possess the financial resources to pay for their reasonable foreseeable resources. So according to this one, still they haven't put exactly how much amount. So the proclamation does not suspend or limit the entry of applicant if they don't have the coverage or possess this one. So you need to have this one, but they haven't put exact amount. But I believe it will be going back to the poverty guideline. that I have this amount for myself, so I'm above the poverty line. If you have maybe, I'm a family of one, I have 20,000 per year, I will be able to cover the medical cost, including like if I can be able to purchase the health insurance or things of that nature. So remember, all these, you make sure that you have all the documentation you need. The proof of the the income they need. Don't just say I'll just depend the money from my neighbor. They need to have actual source of income, tax return, things that they can do like affidavit of support documentation. So there are certain specific documents which are required for someone to prove that I have this means to be able to sustain my life and to cover the insurance on that particular purposes. So these are the two critical announcements. The one which I've already talked in another video, overall public charge, and this one is specific for health insurance. For why does this one doesn't cover for non-immigrant? Because overall non-immigrant, like if you're a student, you have your own insurance, that is student insurance. So they know for sure you are not going to be qualifying obviously with the government. And in most cases, when you are coming under non-immigrant visas, there are certain things that might require for the health insurance in advance, or like your scholarship coming as a student. It will stipulate that you'll be having those kind of insurance and be able to have means in be able to secure if you have any kind of foreseeable medical requirement or demand. So those are the things I want to mention about the proclamation on the health insurance, and they can be able to suspend someone based on that. And even if you are a citizen, you still have to prove that you have health insurance anytime on the filing of the tax return, which is each year between January to April 15. Yeah. So if you have any question, people, please give me a comment here. Lately I was traveling, so I haven't been able to catch up all the comments. So I'll be going back to the comments and responding as I get time. But I really appreciate for the continued support on watching the videos, commenting, sharing to others. And if you are in Twitter, you can tweet, share the link, tag me. I'll be happy to follow your Twitter account. Same way to the Facebook and all other social media. So thank you everyone. I really appreciate it and have a wonderful time. Again, this is EBM Ernest Makulilo. Makulilo out.